My name is Kate Miller and I'm a project manager at the Durham COIN, the Center for Health Services Research in Primary Care in North Carolina. My research is focused on long-term services and supports, specifically those providing supports to caregivers of veterans. So the VA Caregiver Support Program is a partnered evaluation center. It's funded by Query as well as by our operational partners, the VA Caregiver Support Program. The evaluation looks at veteran outcomes in terms of healthcare utilization and total costs over 3 years, as well as looking at caregiver health and well-being outcomes. Caregivers provide so much care. They are, in a lot of ways, the backbone of long-term services and supports in the United States. We know from the literature that caregivers often suffer from high levels of burden or depressive symptoms, and there's a financial strain placed on them by providing care. Yet we do not have a firm understanding of what is the best way to support these caregivers. It does affect the care recipient's care, and in that case, that's the veterans. It is imperative that we understand the best way to support them. The goal of this is to be able to inform our operational partners about which caregivers should receive targeted interventions to ultimately improve their health and well-being, with the idea that this will ultimately improve the veterans' care received from the caregiver. We are incredibly lucky. We have very involved partners through the VA Caregiver Support Program, and we work very closely with them. Their collaboration is priceless. They have helped with everything from the study design to the questions we ask on the survey to which outcomes are not only of greatest interest in terms of research, but also for operational needs. And that, I think, really makes for a wonderful research project when you can not only pursue what's interesting to you as a researcher, but also what will actually help improve services delivered to these caregivers, and having it go directly to the decision makers is wonderful. When we received all the surveys back, we received well over 1,000 surveys, and going through all of them, 20-page surveys, and reading each one and responding to notes within 24 hours was certainly very time-consuming and a lot of late nights, but that is really nothing, and it's just a drop in the bucket, and it's so worth it when you think about who we're serving and wonderful work that they're doing to support the veterans. It makes it all worth it.